So we shall now go on to another very dynamic personality of Indian ophthalmology, Dr. Rishi Mohan, who's a senior consultant, cataract, cornea, glaucoma, refractive, and leading his eye center. So he's going to show us another very interesting video, and let's hear from our experts on that.
Hi, Chitra. Good evening. Good afternoon, rather. Can you all hear me?
Yes, yes, yes.
Hi, thank you so much for inviting me and allowing me to present this video. And thanks to the ARC and to Anagha and yourself and the rest of the team. It's a pleasure to present in front of such a galaxy of speakers and panelists. So let me start my video and start with sharing my screen. And there we are. Right. So, so here I am. I've halfway through my list. I've done 4 or 5 cases already. So I'm, just ordinarily humming along and trying to load my lens. And I introduce the lens, and the lens unfolds absolutely normally, like one would expect in a very guarded fashion. This is the 2.2 incision, and as you can see, the inserter is very small. It's about less than 2 millimeters. And this is where I kind of stop. And I'm thinking, did I not take this cataract out? Why am I seeing this big haze in the middle of my optic? And so I carry on, and then I try and look at it, and I look at it again. And then I think that this is definitely a hazy lens. So I put something underneath to try and see what's wrong. And I realized that the center of the lens is extremely translucent, almost opaque. And so I have no options. So at that point, I don't have a backup. This is an extended range of vision or an EDOF lens. And I had no other option except to explant it. I didn't have a replacement. So it took me a while to consent the patient, consent the relative that I'm going to explant this lens because it doesn't seem to be clear. And I'm going to try and replace it with a monofocal implant with all its antecedent issues. So I go ahead and as per the technique that is described, I make a half incision through the IOL. And then I just, without expanding the lens, the incision too much, making it to about 2.8, I will explant this IOL with a rotation with a hand over hand technique, where I just rotate the IOL out through that incision. Being a hydrophilic foldable lens, it comes out fairly easily without any stress on the zonules, on the incision, or on the rhexis. And I go ahead and implant a monofocal open loop lens and pretty much complete the surgery. Now, this makes me a little wiser, and sure enough, a few days later, I have the opportunity to again do an implant with the same kind of an IOL. But this time I'm thinking, this may also have a problem. So I go and get an additional lens. So I have now 2 lenses of the same diopterage available to me. And I look at the first one as it comes out of the case, and I realize this is also hazy. And so I don't use this lens. And then I go ahead and take another one. And this time I look at it with that thing outside before I even load it. And I think this doesn't seem to be that bad. So I think this one can be used. So I put it into its cartridge. And sure enough, I open it out, and it goes without any issue at all into the bag. And as it opens up, to my horror, I notice that there is a significant amount of opacification in this one as well. Now this is my backup lens, by the way. So I again go through the same rigmarole of essentially getting the consent, and now again putting a lens. And here you can see again the amount of haze that is there in the central IOL. And then again, I expand the incision to approximately 3 millimeters or 2.8. And then I go ahead and explant this lens in exactly the same fashion as I had done a week earlier with the same manufacturer IOL. Again, the same hand over hand technique is used, where one makes a sort of a half cut into the optic, and then one just uses and just rolls or slides this lens out and from one area, and as it rotates, one can see that it very easily slips out without producing too much of stress on any of the tissues that are there. And then, of course, I go ahead and implant a single piece monofocal IOL into the bag. So really, this was an interesting series of cases. There was another one also, which was my third case, again in the same series of IOLs. And this time I had the representatives from the company and all be there because they wouldn't believe what they were seeing. So that was really it. So I thought I'd just share this experience with you on an opaque IOL. So let me see if I can stop sharing now.
Thank you very much, Dr. Rishi. That was a wonderful presentation and different thoughts to think about. But I do believe that there have been case reports where opaque lenses, which appear to be opaque during the time of insertion, it could be just a transient thing because of the temperature difference, because it being stored in a cold place. Could it be that you could have a second time, you could have left the lens for a longer time in room temperature? I'm sure you would have gone and read about it more and left it in the room temperature and then inserted it after a half an hour or more. Maybe the experience could have been different because these are seen in hydrophilic with hydrophobic coating lenses rarely. So
you're absolutely right. And yes, that was the thought, and that was what happened. And so the third one, I didn't implant. It was opaque while it was outside, so I put it back away. So what happens is, this is a manufacturer whose lenses I have now used for about 2.5 years. And I never had a problem with this. And then this suddenly happened. So I thought it was a batch related issue rather than a temperature related issue, because these lenses were being delivered at room temperature. They were never being maintained through a cold chain. However, this was in the month of August, I think, that these instances took place. It's a very hot period. Okay. And there was an advisory from the manufacturer, which was not known to me, which had come to the local distributors, that these lenses must be maintained in a cold chain. So for 2.5 years, they were supplying lenses at room temperature, and suddenly they changed their delivery into a cold chain delivery, where they were maintaining these lenses in a refrigerator in their own warehouse. And then they were transporting them through the cold chain all the way up to us. And they had instructed my staff in theater not to leave these lenses outside and to put them in the fridge. Yeah. So actually, it was a problem of temperature reversal. Later, of course, they shared with me the data from the factory, wherein if these lenses are stored at 8 degrees, it takes 4 hours. Yes. For the IOL to clear up. But I'm not going to sit around for 4 hours with the lens inside the eye, or then have this lens outside for 4 hours. What has then happened, of course, in the as the corollary or the outcome of this entire exercise is that cold chain has now been stopped. So based on the data that I provided them, I said this is not appropriate, and you can comfortably keep these lenses at room temperature. Why do you need to chill them? And so they were reverted back to their older technique of delivering without the cold chain. So, so it was interesting in any case. And other than these 2 or 3 patients where I did not have a backup of an EROV lens or a multifocal of the same power available, and had to explant these and put in monofocal IOLs, they all went off without a hitch. So that is the learning, yes, that if we know about the cold chain, then we need not have removed the lens. You are a great surgeon and you did the whole thing very gracefully, but it could have been a challenging surgery probably, and these lenses could have been left probably. That's what we learned. The other thing is there have been instances, Chitra, where I must have explanted about 28 of these lenses going back about 20 years. When there was a couple of batches of lenses that were received from the US that were opaque, and they opacified not immediately, but sometime after the surgery was done. So I'd used about 140 of those lenses, and about 40% of them had varying degrees of opacification. And anyone who dropped below 6/9, which are, I think, about 28 or 29 patients, I actually explanted those lenses. Some of them were actually phacotrabs and more complicated surgeries, and it was quite a challenge. But that, of course, goes back almost 2 decades. Okay. While we are talking about this opaque lenses,
I wanted a comment from the expert panel. If there are some glistenings on the IOL, would you feel that these would impact vision anyway, excepting for the aesthetic appearance?
Is that for me?
No, I wanted the expert
Okay.
panel to comment on it.
Sure.
I don't think so.
Uh,
I've seen lots of cases of glistening in some of the earlier Acrisoft lenses. Alcon used to make lenses, and there was some problem during the polymerization process due to some temperature differences. And some of the earlier IOLs used to have a lot of glistenings, and I'm following up with these patients, which I started implanting more than 20 years ago. And no, not really, not significant enough.
I think the glistenings are significant. They could have an impact on the contrast and the quality of vision. May not be in the lens visual acuity. Coming to your case, Rishi, I mean, one interesting aspect was the second case where you actually inspected and made sure that the lens was clear. And when you put it in the cartridge, it was clear, but when it came out in the eye, it was opaque. I mean, what kind of chemical transformation happened while you were injecting the lens in 30 seconds? And second is, the first case, especially, you hardly enlarged the incision, you took the lens out, and you said that this was an EDOF lens. Why didn't you go for a multifocal implant when you anyway put in a second lens? Why did you shift to a monofocal?
Basically, that thing which happens is because of the micro bubble formation and that light refraction which occurs causes this kind of a clouding. And it is said that once the air dissolution occurs, that it settles down to equilibrium, this clouding disappears spontaneously. So that is the theory behind it. And I'm sure when each of us are doing the surgery, I had to read about this particular thing as to why it could have happened. So I'm answering, but that is the reasoning behind it. Again, they say that you could get some of the clouding in these some lenses, even if there is a interruption in the blood aqueous barrier, there is a change in the osmolarity in the eye, or there is something intraoperatively, the milieu is not normal, or even rarely in a diabetic. These are the things which came up while trying to understand about opacification of IOLs. Anything to add, or shall we go?
Are you going to escape with that, Rishi, or are you going to answer the question?
No, I think Chitra has answered the question in the question itself.
I wanted the expert to answer. Now the expert has got just to.
I'm really intrigued. I'm really surprised.
I just would like to make a point. This is also for the beginners, for the mid-level surgeons. I mean, when you see something, what would be the, Dr. Rishi has said when he experienced, he has used these lenses for 2.5 years, but you see a lens which is opaque right at the beginning. Would you discard that company? I mean, until and unless this issue is solved, would you continue with these lenses? I'm wondering how you went on continuing with it. I, as a surgeon with 25 years experience, I would say, sorry, I would not, till it is clear what it is. So I just wanted to ask.
Good point. Let me answer Chitra's question, then I'll answer Ajoy's.
Until unless you have a financial interest. I mean, that's what.
No. I'll tell you what happens. So when I have used almost 90 or 100 of these lenses without any reason to complain, and this was just the first one. So the first one came as a complete surprise. In fact, I didn't inspect it or anything. I just took it out of its wet case, loaded it and inserted it. And the shock came when I saw the opacification on the inside. The next time I was much more wary. It was a different batch. It was a different power. And I got two lenses of the same. I said, I don't trust you guys. I don't know what you guys are doing, which is different, even though they insisted they've done nothing different. So this whole thing about the cold chain delivery, I did not know about how they had changed this, because in the end, it all happens through the back office. It doesn't go through me in the hospital. So when the second lens was opaque, I opened the third one. And the third one I thought was clear. It was that the process of folding it and the insertion. And when I go back to Chitra's question about waiting and allowing some hours to elapse, I did not realize that it takes that much time for the temperature reversal to set in. And it was at least 20 minutes between my implanting the lens and actually explanting it, because I had to go through the process of explaining it to the patient. Then I had to send a new consent form out for the relatives to sign before I could explant that and replace it with a monofocal implant. And in that 20 minutes, there was no change in the way that lens looked. And so that prompted me into removing it. I am completely with you. I recall the conversation I had with the vice president of that company in which I had to explant these lenses. And you know what that man said? Sir, you implant 50 more and then give us a feedback. I said, I've already removed that many. And so there was, but that was, of course, a different era where they used to just consider that, Indians didn't know what they were talking about and we didn't know how to handle lenses. With this particular episode, this is recent. It's only about 1.5 years or 2 years now. And I changed my irrigating fluid. Normally, I wash these lenses with moxifloxacin. I didn't do that. I changed my viscoelastic. And I allowed some temperature reversal to happen before I took up the second lens. But in spite of that, I had to do the explant, and thought that would be an interesting story to share with everybody here on the panel.
Yes, definitely a very interesting case. And thank you so much, Dr. Rishi. Do stay connected. We have more interesting situations coming up. Annaga, would you want to add anything in this discussion? I'm so sorry, I missed her.
No, not at all, ma'am. Actually, very, very interesting and lots of learning. And only thing is, suppose these are preloaded lenses, then you would never know. Here, probably you are loading it externally, you could actually inspect it. But there are similar lenses, AIOS lenses, which are preloaded. So here, then probably we need to actually remove it, inspect it, and then load it again. I don't know. So
that
this
defeats
is something.
the purpose.
Yeah, we have to totally reverse the procedure, just to avoid such a problem.
Yeah.